The Saskatchewan Prevention Institute is a nonprofit organization that works to reduce the occurrence of disabling conditions in children, including fetal alcohol spectrum disorder. The Prevention Institute raises awareness by providing training, information, and resources that are based on current best evidence. Programs include child injury prevention, child traffic safety, community action program for children, early childhood mental health, fetal alcohol spectrum disorder prevention, maternal and infant health, nobody's perfect parenting, sexual and reproductive health. So why should we be talking about alcohol? Well, alcohol is very popular in Canada. But did you know alcohol is a drug? Alcohol is a depressant drug that can slow down the parts of the brain that affect thinking, behavior, breathing, and heart rate. Alcohol is the most commonly used drug in Canada. In Saskatchewan, the legal age for alcohol use is 19, but it is lower in other provinces. It's important to talk about alcohol so we know what it really is, what happens when we drink it, and how it impacts us and our community. Alcohol comes in all sorts of colors and textures. It can be clear, for example, it could be vodka or gin. It can be colored, for example, red wine. Or it can be dark brown, for example, stout or dark lager beer. Most of the time, people drink alcohol as a liquid. It is sometimes a solid, such as gelatin shots, or it can be put into fruit. It can also be inhaled as a vapor. The scientific name for the alcohol that we drink is ethanol. Alcohol can also be found in mouthwashes, aftershave lotions, or rubbing alcohol. Drinking these products can cause an overdose and poisoning. A different type of alcohol, known as methanol, is found in hairspray, paint removers, and antifreeze. This type of alcohol is poisonous and should never be swallowed as it can be deadly. Most Canadians drink alcohol. In 2017, almost 78% of Canadians 15 years and over reported that they used alcohol in the past year. That is about 8 out of 10 Canadians. That also means that 2 out of 10 Canadians did not use any alcohol in the past year. Many people underreport their alcohol use, so people are using more alcohol, most likely, than reported. Some people do not drink at all. Some are light social drinkers. Some drink hard, sometimes, but not all the time. And some drink every day. Some people used to drink, but for one reason or another have stopped drinking. So, why do people drink? Well, they may drink to socialize with friends, family, and work colleagues. They may drink with meals to accompany food. They may drink to relax. They may drink because they like how it tastes and how it makes them feel. Some drink because they're feeling stress. Some drink because they're happy and celebrating something. Some drink because of peer pressure or wanting to fit in. Some drink because they're feeling sad or have other negative emotions. Some people drink because they're bored. Some people use alcohol because they want to get drunk. Some people drink because they're trying to numb painful memories or trauma. Some drink because they depend on alcohol. Some people drink because they have a substance use disorder. Sometimes parents, other adults, and older brothers and sisters can act as role models for children and youth, which passes on risky drinking patterns to the next generation. Some people are coping with emotional problems, trying to reduce stress, or even lose weight. Some want to bond with friends, relieve boredom, or improve their sense of self. They're influenced by ads they see for alcohol online, on television, or in magazines and on billboards. Many sporting events are sponsored by alcohol. So something that can be thought about is, where do people drink? Well, many locations. They could be something such as a party, in homes, outdoors, community centers, weddings, birthdays, other celebrations, bars, clubs, pubs, watching sports events such as hockey and baseball, after playing sports, such as a team having a drink after a game, restaurants, at home with friends, at home by themselves, music festivals. There are so many places where people can choose to drink. And people who do not drink often feel pressured to drink. They're often asked why they're not drinking. And this can be especially difficult for someone who has quit drinking because of alcohol dependency, or for a woman who's pregnant but is not ready to tell people. So an activity that we have sometimes done is to ask people to think of what's another word for sleep? And maybe just take a couple of seconds to think about another word for sleep, or even maybe type it in. Hi, seeing I've got rest and rest. Okay, what's another word for work? Toil, labor. Okay. Oh, I've got one more coming in. Okay, now I'm looking for a word for drunk. And please join and type. We've got hammered, inebriated, intoxicated, bad word, starting with P, sloshed, off your face. So what you may have noticed in this little test experiment, blacked out, is that there seem to be a lot more words that we come up with when we're talking about drunk than for when we're talking about other, a couple of other parts of our life, such as sleep and work. So it's just kind of helps remind us of how prevalent, how used alcohol is in our society, and just the number of words that we have even for using alcohol or getting drunk, be it very polite words or be it slang or whichever. So it's just kind of that reminder that alcohol use is so prevalent. So the next item is, how does alcohol work? Well, when a person drinks, the stomach and the small intestine absorb the alcohol. The stomach and small intestine spread the alcohol to the entire body. This happens quickly because alcohol molecules are very tiny and they can dissolve in water. The rate at which alcohol moves into the bloodstream is influenced by how much food a person has eaten. If the stomach is empty, the alcohol will pass into the bloodstream right away, and a person will feel its effects more quickly. If there is solid food in the stomach, it will take longer. The amount of alcohol circulating in the bloodstream is called the blood alcohol concentration, or BAC. The more alcohol a person drinks, the higher his BAC, and the more drunk that person will become. Other things that affect the blood alcohol content include how quickly a person drinks, having food in the stomach, as mentioned, a person's body size, age, genetics, and sex, whether you're male or female. Once alcohol is in the bloodstream, it travels through the body to the different organs. It goes quickly to the organs with many blood vessels, such as the brain, the lungs, and the liver. The effects in the brain are seen first. It can change a person's judgment, attention span, memory, and reaction time. It also slows down muscle movements and speech. When too much alcohol is used, a person gets drunk, and this can lead to a greater chance of alcohol-related harms. In extreme cases, more drinking can lead to alcohol poisoning and even death. So as I've mentioned before, alcohol is a drug, and it can cause harm to our bodies. Alcohol is also a carcinogen. It can cause cancer. Alcohol has been linked to 7 different types of cancer, including breast and liver cancers. Alcohol is also a teratogen. It can harm the cells of a developing fetus, an unborn baby. A fetus exposed to alcohol may have birth defects. There is a saying out there, "What's your poison?" And that's often used to ask people what type of alcoholic drink they would like. So when we think about alcohol's impact, this question, "What's your poison?" might be pretty truthful. But when talking about alcohol, it's good to look at both the good and the not so good. First, we'll take a look at the perceived benefits of alcohol. What people may feel are benefits of using alcohol. So here are some of the reasons people may give for drinking. Forming new friendships and strengthening existing friendships. Being social, enjoying and having positive social experiences. Being part of a cultural tradition. Having a positive mood. Having positive mental well-being. Reducing stress. Improving mental health. Having fun. Celebrating, feeling sophisticated, feeling good, relaxing. Some people think a drink can be good for their health. In fact, there was a lot of information coming out a few years ago that red wine would be quite beneficial for hearts. But evidence suggests that the benefits from drinking alcohol are not relevant for all individuals, all ages, and all situations. And for young people, there are no health benefits to using alcohol. The potential health benefits from alcohol do not begin until middle age. And as I said, different for all people. Short-term harms of alcohol. So now that we've looked at what people may see as benefits of drinking, talk a little bit about harms of alcohol, both immediate and over time. Alcohol-related harms across Canada are on the rise. The risk of an injury grows with every additional drink a person has. So, actually, I'm going to invite you all to once again join in the conversation by typing in our chat box. So, what are some harms that you're aware of? Through your work or through friends or from reading or whichever that you've seen that are related to alcohol. Poor decision making, accidents, violence, drinking and driving, FASD, could lead to addictions, hurt others. Wonderful. Abuse, financial losses. I see some more coming up. Depression, unwanted pregnancy. Thank you very much. And I have a list here too, so I will see how mine compare. I know that you've got ones that are on my list. Getting drunk and throwing up, memory loss and blackouts, alcohol overdose, poisoning, death. I see another one has added losing family. Social relationship problems, exactly. Violence, family problems, crime, murder, regretful behavior, abuse, car crashes, drinking and driving, unplanned sex, unwanted sex, unprotected sex, unplanned pregnancy, mental health issues such as addictions, as was mentioned, depression, suicide, injuries, getting arrested and having legal problems such as DUIs, losing one's license, greater risk of getting a sexually transmitted infection from unprotected sex, using other drugs. In Canada, alcohol is the top risk factor for poor health among Canadians aged 15 to 49 years. So over time, there can also be long-term effects because of drinking. Some of these effects can be alcohol use disorders, a greater risk of several types of cancer, health problems such as diabetes, cirrhosis of the liver, strokes, pancreatitis, heart problems, liver disease, fetal alcohol spectrum disorder, learning and memory problems leading to dropping out of school, money problems, mental health problems such as depression, anxiety, suicide, social, school, work, and money problems such as family problems, work problems from a poor attendance or poor performance at work, money problems, unemployment, failing or quitting school, trouble getting pregnant, infertility, weakened immune system, so people are getting sick more often. One of the long-term harms from drinking alcohol during pregnancy can be for the child, as I mentioned just a little bit earlier, and the child can experience lifelong challenges with their brain and body, and this is known as fetal alcohol spectrum disorder. So something that you can think about and just keep in the back of your mind as I move on through the next, say, slide or two is, what seems to be happening in your community with young people and alcohol? Or better, let's have an online discussion again, a written discussion. What do you see happening in your community with young people and alcohol? Let's see, I've got eviction, lots of drinking and driving, younger, and addictions are younger and younger. It's getting younger and younger for drinking, a lack of respect for others. Yesterday, I saw several early 20-somethings all walking together down the street back from the liquor board store. And were they keeping 6 feet apart would be the next question. And these days where we have to keep our social distance, absolutely not, they weren't. That's unfortunate. And I see another answer coming. Losing children to services. It's easier to obtain alcohol. Yes. Poor coping skills. Thank you so much for joining in this conversation. It feels so much more like we're, having a conversation when we're able to do this instead of me just sharing information with you. In Canada, young people drink alcohol. I know people drank alcohol when I was growing up, which was many years ago. I hate to say it, but probably about 40 years ago. And it's always been something that people have done, but we definitely are noticing it with our young people today. Many people start drinking when they're in their teens. And I see someone has talked about influences from peer pressure, and kids use it as a cool factor, once again, due to peer pressure. Right now, the average age for students to try drinking is about 13. In 2016-2017, more than 40%, the actual number was 44%, so 4 out of 10 students in grades 7 to 12 reported using an alcoholic beverage at one point in the past 12 months. 2 out of 5 students. Almost 1 in 4 students had 5 or more drinks on a single occasion. That is risky drinking. A Canadian National Alcohol Use Survey showed younger drinkers underreport their alcohol use more than older drinkers report their alcohol use. Drinking and the amount used by young people may be higher than the numbers are even telling us. It is also good to remember, though, that these statistics are also showing us that 3 out of 5 students did not report drinking alcohol in the past 12 months. So why do young people drink? And we've already looked at some of those answers. Having fun, feeling good, being social, celebrating, liking the taste, drinking games. It's easy to get. Coping with stress or pain, feeling down or sad, coping with negative situations, coping with trauma, discrimination, having a family history of substance use and/or mental illness. It is healthier for teens not to drink until they're older. And why is this? Well, alcohol can harm all parts of the developing brain. The human brain continues to mature throughout adolescence and well into a person's 20s, around the mid-20s. In particular, the prefrontal cortex of the teen brain is under rapid development. This part of the brain is the control center for making decisions, understanding and using what we learn, and problem solving. With all the changes that are happening in the brain at this time, alcohol use can affect brain function, thinking, and behavior, as well as attention, learning, and memory. When people start drinking early, as in young, they are more likely to be hurt by their alcohol use than if they wait until they're older. Teens who start to drink at a young age often have a higher chance of developing problems with alcohol, such as becoming dependent or addicted. They can also develop learning and memory problems and have a higher chance of developing certain chronic diseases. Problem drinking can happen for many reasons. Some of them are marketing, how easy it is to get alcohol, the family relationships with peers, experiences of abuse and trauma, lack of stable housing, family income. Too much and risky drinking can affect youth in many ways, and this includes injury, memory loss, unwanted sex, assault, suicide, self-harm, alcohol poisoning, car crashes, fights, arguments with friends and family members, having problems with school. There are some subgroups of young people who seem to be at a higher risk for substance use and related problems. This group includes people who are homeless and street involved, Indigenous, members of the LGBTQ community, in the justice system, living with co-occurring mental health problems, having a history of trauma. But there are influences that can help protect or help build resilience in young people, and these include feeling connected to school, positive relationships with caring adults inside and outside of the family, supportive peers, school and community safety. So now that I have given some background on alcohol, perceived advantages, the disadvantages, I would like to start looking at ways to reduce these impacts, or some information on that. But I want to start with a discussion or sharing information on Canada's low-risk alcohol drinking guidelines. And in order to start that discussion, I want to share some information on what is a standard drink. Because we ask the question, how many drinks have you had, or how many drinks are young people using in a week or on a weekend. And we may get a variety of numbers, but what really is a standard drink? Because there's quite a difference between a schooner of beer and a bottle of beer in the amount of alcohol and the amount of liquid that's consumed. So Canadian researchers and doctors looked at the research about alcohol, and they did develop Canada's low-risk alcohol drinking guidelines. These guidelines give us information to lower our risk if we choose to use alcohol. As part of the low-risk drinking guidelines, researchers calculated standard drink sizes. Using a standard sizing helps us to measure our drinks, and then we can count the number of drinks that we have. This allows us to keep track of our drinking and to set limits for ourselves. Essentially, it allows us to make informed choices and to control our drinking. But it's not always easy to know how much to pour to make a standard drink. And an activity that you can try is just to take a glass that you might use for drinking water, or to take a wine glass and just try pouring liquid into it and guessing how much it is. If you've got a large wine glass, just trying to pour a standard drink, which is 5 ounces of wine, and see how easy it is to guess. So that if you happen to be out, say, at a party and using wine or something else, are you really having a standard drink, or is it more, or even maybe less? So that activity can always be kind of fun. Just pour the liquid and then pour it into the glass, and then pour it into a measuring glass afterwards to see how much you actually poured. It's not always easy. So in Canada, a standard drink has 14 grams or 0.6 fluid ounces of pure alcohol. This is generally equal to 1 bottle of beer. Most coolers, although some are a higher alcohol content and are more than one standard drink, a 5-ounce glass of wine, and 1 1/2 ounces of hard alcohol. So when we take a look at the picture, we see a wide variety in what's the amount of liquid or the size of the liquid, but that all has the same amount of alcohol in it. Now, it can go up and down a little bit because with wine, the 5-ounce glasses of wine is based on the wine that is being used as having 12% alcohol content. There are wines that have much higher alcohol content, 13%, 14%. So it's not always completely, say, accurate when we pour the 5 ounces, but it's in the vicinity, and it gives us a good guideline, a good starting point for keeping track of these things. So each of the drinks in this picture do have that same amount of pure alcohol. But people out there often have the view or the thought that one type of alcohol drink may have less alcohol and be safer than other types. They may think that amount of gin is going to have way more alcohol content than if they're having a cooler or if they're having the 5 ounces of wine. And another challenge related to the wine has been often when one goes to a restaurant, if one's ordering a glass of wine, that they'll come in the 6-ounce and 9-ounce sizes, but you can't even get the 5 ounce. Although I've noticed some of the places lately have been moving more to the 5 ounces of wine, so maybe they're starting to think about what a standard drink is. But no type of alcohol is safer than another. Be it, having gin is no safer than having wine, which is no safer than having the 12 ounces of cider or the 12 ounces of beer. Now, just to give you a little bit of a change or a break from my voice, I am going to show a video which also explains the low-risk alcohol drinking guidelines. And this video can be found on YouTube, and it's called Understanding Canada's Low-Risk Alcohol Drinking Guidelines. And I'm just going to show you, that's a pamphlet of Canada's Low-Risk Alcohol Drinking Guidelines. And the Saskatchewan Prevention Institute is listed on the CCS, Canadian Centre on Substance Use and Addiction website as a supporter of the Low-Risk Alcohol Drinking Guidelines.
What we want to talk about today is Canada's new low-risk alcohol drinking guidelines, what they are and what they mean to you. This is really about how to reduce your risk when drinking alcohol, or how to rethink your drinking. Before we get too far, we should first talk about what a standard drink actually is, since what one drink is to me might be very different from what one drink is to you. When we talk about a standard-sized glass of wine, we don't mean that large glass that can fit an entire bottle. What we do mean is 5 ounces, or 142 milliliters of wine, which is a standard drink. What about beer? Is it that keg-sized draft beer that's as big as your head? A standard drink of beer is 12 ounces, or 341 mils, which is found in a typical bottle of beer. So what about the hard stuff? 1.5 ounces, or 43 milliliters serving size of any hard liquor is one standard drink. Let's recap what one standard drink is. 5 ounces, or 142 milliliters of wine, equals 12 ounces, or 341 milliliters of beer, which also equals 1.5 ounces, or 43 milliliters of hard liquor. Each of these equals one standard drink. So now that you know what one standard drink is, let's look at how else you can rethink your drinking. To lower your risk of alcohol-related injuries and diseases, follow these low-risk alcohol drinking guidelines. If you are a healthy man, drink no more than 3 standard drinks in one day, and no more than 15 standard drinks in a week. But remember, less is always best. Every week should have at least 2 days without drinking to avoid it becoming a habit. If you're a healthy woman, drink no more than 2 standard drinks in a day, and no more than 10 standard drinks in a week. Again, less is always best. Every week should have at least 2 days without drinking to avoid it becoming a habit. Remember, these are maximum amounts to decrease your risk of injury and chronic disease, so less is always best. Alright, so now that you know what 1 standard drink is, and how to rethink your drinking to lower your risk of alcohol-related injuries and disease, let's talk about when 0 alcohol is the limit, like when driving a vehicle, or taking medication that's not to be mixed with alcohol, or doing something like high-risk activities. 0 alcohol is also the limit when not recommended by your healthcare provider, if you're pregnant or planning to become pregnant, or making important decisions. 0 alcohol should also be the limit when you're responsible for the safety of others. Okay, let's bring it all together now. When you rethink your drinking, keep in mind what a standard drink is, your daily and weekly limits, and when 0 is the limit. For more information, speak with your healthcare provider or contact your local public health unit.
I really like that video and the way that it shares the information about the low-risk alcohol drinking guidelines. So you most likely noticed that the amounts of alcohol allowed per day and per week are different for men and women. So why is it that the amounts are different for women? Well, women's bodies deal with alcohol differently. A woman has less water content in her body than a man. Water helps to weaken or water down alcohol, so therefore a man's body is able to dilute the alcohol more efficiently. Women have a lower concentration of an enzyme that breaks down alcohol before it passes into the blood. And that enzyme is called dehydrogenase. Therefore, a woman's body takes longer to process alcohol than a man's body. Women often weigh less than men, and people who weigh less reach a higher blood alcohol content levels than those who weigh more when they're consuming the same amount of alcohol. Women have a higher body fat content than men. Body fat does not absorb alcohol, so alcohol content remains higher in women. Because of this, women often feel drunk more quickly than men. There are many terms used to describe ways of drinking. Some of the terms, particularly for challenges with alcohol, can raise stigma, and they can make it more difficult to talk about alcohol use. And it's changing when it comes to using many of these terms. So I've given some of the ranges of drinking patterns on this slide. Some people do not drink alcohol. Other people may drink once in a while with friends or when having a meal, which may be part of their social life, so they'd be more of a social drinker. But drinking alcohol can become a habit for people, and some people do drink more than the recommended levels. People who abuse alcohol may not be dependent on alcohol, but they can have family, work, or other school problems because of their alcohol use. Their drinking may lead to risky behavior, and they may use poor judgment. So that could be risky drinking. People can be dependent on alcohol, where they feel they need it. The terms dependence or addiction are often used. Addiction is a physical need that is hard to control. A person builds up a tolerance and it takes more and more alcohol to feel the same effects. People who have an alcohol addiction go through physical and mental problems when they don't have something to drink. This is called withdrawal. The word addict or addiction can make it sound like there is no hope, so substance use disorder is now used. And when calling a person an addict, it does have a lot of stigma, that word. So substance use disorder, or someone with a substance use disorder, is more of a recommended term now. A substance use disorder often becomes socially harmful. The person does anything to get alcohol and to drink. It begins to interfere with relationships, work, school, and other parts of the person's life. A substance use disorder can cut someone off from family and friends, their culture, and community. It also has an impact on family members. It's very difficult to watch a loved one struggling. There's often a feeling of frustration. If they would just quit or if they would just get help, things would get better. However, dealing with dependence is not simple. So how many drinks does it take to be considered risky or binge drinking? And this often comes as a surprise when I'm dealing with doing a presentation to younger people. For women, risky drinking is 4 standard drinks in a single occasion. For men, it is 5 standard drinks at a single occasion. Often when I'm talking to younger people who are going through that drinking phase or doing a lot of drinking, they're more likely to say that risky drinking is 15 drinks in an occasion, and that's a definite difference. Some examples where people might do more of what's called risky drinking or have a little more is at occasions such as a wedding reception, a family dinner, a party, an evening playing cards with friends, or drinking in a bush party. Risky drinking increases that risk of alcohol-related harms, such as the ones that we communicated about earlier. For young people, the binge drinking is more likely to cause blackouts, hangovers, behavior they regret, arguing or fighting, becoming sick, injuring themselves, stealing or damaging property, unplanned or unintended sex, passing out, alcohol poisoning, being emotional, unknown physical injuries, spending more money than had been planned. Some of the lasting effects of underage binge drinking include slowed motor skills, difficulty learning new ideas, problems making decisions, decreased abilities in sports, health-related problems such as cancer and cardiovascular disease, alcoholism as adults, trouble with the law. Risky or binge drinking when pregnant increases the harm to the fetus. The low-risk alcohol drinking guidelines provide some safer drinking tips in the brochure for people who choose to use alcohol. And something that I haven't really mentioned is that in the low-risk drinking guidelines, 0 is a good number. And the guidelines are also not a goal. It doesn't mean that you have to have 3 drinks in an evening if you're a guy. You don't have to have 15 drinks in a week. 0 is a good number. So some of the guidelines for safer drinking include set limits for drinking and stick to them. Drink slowly. Have 2 drinks or less in 1 3-hour period. Alternate between alcoholic and non-alcoholic drinks. So a glass of wine, a glass of water. Eat before and while drinking. Think about your age, your weight, and any health issues you may have, if cutting back on drinking or not drinking at all might be the best idea. Some people who have issues with alcohol use have to be careful when they are looking at making changes, and it's always good to talk to a healthcare provider, an addiction counselor, to have someone working with them when they are looking at making those changes. Benefits of following the low-risk drinking guidelines can include these: better sleep, no more hangovers, better fitness, better weight management. Alcohol has calories. More designated driver options, more patience, drinking quality instead of quantity, easier to concentrate. So, what have you heard about alcohol and sex? So, what have you heard about alcohol and sex? Would any of you like to throw some comments in our chat box to share what you know about alcohol and sex? I have somebody typing. Regret, LOL. Alcohol and sex seem to go together. Alcohol can act like a social lubricant, which means people are a little braver and may connect more easily with others. They may feel less inhibited while drinking. When people have been drinking, they're not as responsible about organizing or insisting on protection to prevent sexually transmitted diseases. And I see someone just said unplanned pregnancies. And people, yes, and if you're not using protection, you can have sexually transmitted infections. Young people in particular, those who use drugs or who drank before having sex, were less likely to use a condom than if they were sober. When people do not use protection, as mentioned earlier, they can get sexually transmitted infections. As well, there could be an unplanned pregnancy. And approximately half of all pregnancies are unplanned. Young people under the age of 25 who become pregnant are more likely to have unplanned pregnancies than those who are older than 25. If a female does not know she's pregnant and she continues to drink, the fetus will be accidentally exposed to alcohol. Children are a gift, yet many people are not ready to be parents, especially young people. Teenagers are going through their own developmental issues, they're struggling with hormones, they're figuring out who they are. Some adults aren't ready to become parents either. They may be struggling with things of their own, or it might not be the best timing for them. When young people have children too early, their babies are more likely to weigh less and to be born early. Young mums don't always get as much prenatal care, and this can increase the chances of poor health outcomes, including infant death and poor health for the child. But this does not mean all teenagers who have babies have unhealthy pregnancies or do a bad job of parenting. Some are very responsible, have healthy pregnancies, and are great parents. It's best for everyone, though, no matter the age, if our children are planned to come along at a time that works best. So, talked about young people and alcohol, women and alcohol. Here's some information on men and alcohol. Generally, males start to drink earlier than females. Males in all age groups drink more than women. However, women are catching up in their drinking. Men also do more risky drinking than females. More males than females drink in patterns that exceed the low-risk alcohol drinking guidelines. And men drink more looking for positive effects and social aspects than women. So here's some information about men and alcohol. Males' reasons for alcohol use are tied to bonding with friends, relieving boredom, or enhancing their sense of self. Among drivers in fatal motor vehicle traffic crashes, men are more likely as women to have been over the legal limit. In fact, it's approximately 1.5 times as likely as women to have been over the legal limit. Men have a higher risk of colorectal cancer. Males aged 20 and older are more likely to be hospitalized for conditions entirely caused by alcohol than females. Men have higher rates of emergency department visits related to alcohol. Men have higher rates of alcohol-related deaths than women. Risky drinking is commonly involved in sexual assault. Alcohol use by men increases the chances of having unprotected sex, sex with multiple partners, or sex with a partner at risk for a sexually transmitted infection. Alcohol use can cause impotence and infertility. Risky drinking increases violence and the risk of physically assaulting another person. Men are more likely than women to die by suicide and more likely to have been drinking before they died. Alcohol is the most commonly used substance among females, Women and girls are drinking more than they used to drink, and they're catching up to males in their drinking. They're also drinking alcohol in more harmful patterns. As the drinking increases, the risks increase. Women are more vulnerable to the effects of alcohol. Between 2003 and 2016, there was a greater increase in the alcohol-related visits to the emergency departments experienced by women as compared to men. In the past, since women were not drinking as much as men, there were fewer negative impacts. Now the rate of alcohol-related hospitalizations and death is growing faster for women than it is for men. Women often drink for different reasons than men. They drink for reasons such as coping with emotional problems, reducing stress, coping with eating disorders, more permissive drinking norms and values for and among women. There was a day when women weren't even allowed to go into bars, or they had to have separate entrances. Women have more education. They're in the workforce. They're wanting to feel more affectionate, sexy, and feminine. Living with trauma. They've been victims of sexual abuse, or they've experienced other trauma. Being influenced by the marketing and the alcohol industry. The alcohol industry has marketed their products to young people and women as a way of increasing profits. Many children, young people, and other vulnerable groups are exposed to alcohol marketing through magazines, radio ads, TV ads, social media. Some call this the pinking of the market. There are sweet drinks, flavored vodkas, fruit coolers, and special wines for women, girls' night out, mummy juice, and mummy's time out. There are a lot of memes and a lot of ads out there too that talk about how women need to have a break from their children by drinking. As I mentioned earlier, alcohol affects women differently than it affects men. It affects them more quickly. Their bodies take more time to break down alcohol. Women are at a higher risk of certain health problems, even if they're drinking the same amount as men, pound for pound. As their drinking increases, alcohol-related health risks increase more rapidly for women than for men. Greater use of alcohol is a worry for women of childbearing age. If a woman is drinking and becomes pregnant, as I've mentioned before, alcohol can harm her unborn baby. Alcohol is seen in many ways, such as advertisements, television, music, movies. Alcohol companies are on social media. This type of exposure increases the chances of using alcohol. Marketing can shape social norms because it shows substance use in a very positive way. It shows social approval, independence, self-image, adventure-seeking. Exposure to the alcohol through television, music, and movies is connected to starting smoking and using alcohol by children and adolescents. The internet, newspapers, TV shows, social media, magazines, and other media, they give confusing messages about the benefits and harmful effects of drinking. Such as, and I've got some quotes for you, drinking reduces the chances of getting heart disease. A glass of wine is good for your heart. Well, this has been researched further, and it's now understood that an occasional glass of wine may only be beneficial for a very small number of people and under certain conditions. Here's another one. Alcohol-related disease overtakes hepatitis C as a top reason for liver transplant. Alcohol is responsible for more hospital admissions than heart attacks last year. New alcoholic treatment center in Vancouver keeps drinking on the table. After a teen's death, should high-sugar drinks be sold in Canada? What was previously thought to be a marginal benefit of moderate alcohol drinking is now considered a marginal cost to health. But moderate alcohol drinking may boost heart health. Different messages. It gets very confusing for people out there. So if you're using this as a presentation, you can start a discussion with people about what have you heard about alcohol and pregnancy. It's safest not to use alcohol when pregnant for the woman and also for the unborn baby because of the risk of harm to the woman and the unborn baby. A lot of times when we're talking about alcohol and pregnancy, we're stressing the baby. But it's really important to stress that we're concerned about the woman and we're concerned about her health as well. There are many reasons, though, why someone might use alcohol in pregnancy. And I'm just going to ask if you want to take a minute here, and I'm asking you to join in and give me what you think may be some reasons for alcohol use in pregnancy. So please join by typing in an answer. Stress, depression, addiction, not knowing you're pregnant. Those are wonderful additions to the conversation. Thank you so much. And yes, they don't know they're pregnant, and about 50% of pregnancies are unplanned. They don't quit using alcohol until the pregnancy is confirmed, even though they're trying to get pregnant. I see abuse has been added to the conversation in the chat line. Thank you. A lot of people still don't know that alcohol can harm the baby. And there are really confusing messages that leave them unsure about what to do. Some people might be using alcohol, someone added, because they're aborting. Drinking is normal in their community, with their families, or with their friends. Drinking is a habit, a dependency, or an addiction. They might be trying to cope with trauma or difficult life situations. Their doctors told them it's okay to drink a little in pregnancy. They know other people who drank in pregnancy and their children were healthy. Some women use alcohol because they're not happy they're pregnant. There are so many reasons why people use alcohol in pregnancy. This is just a short list. Something for us all to keep in mind, though, is that a woman's life, her history, her experiences don't simply disappear the minute the pregnancy test tells her that she's pregnant. The reasons a woman may drink before she gets pregnant are probably still there when she finds out she is pregnant and can lead to alcohol use in pregnancy. And I see that somebody else had joined our conversation and shared misinformation. That's right. There is so much confusing information out there. An economist a few years ago wrote a booklet, and as part of the book she said it was fine to drink when you were pregnant. And she was challenging the research that says it's best not to use alcohol when pregnant. It's very confusing to know what to do because there's so much different information out there. What we strongly recommend, what we advocate, is zero alcohol is safest when trying to get pregnant and when you're pregnant. This protects the unborn baby from being harmed by alcohol. And not drinking also includes the partner, even though the partner's drinking does not directly cause FASD. The man's sperm can be affected by alcohol, and research is looking at how the father's drinking can impact the fetus. If a woman has used alcohol before she knows she's pregnant, she can talk to her doctor or a healthcare professional. Drinking at low levels is also not a reason to stop a pregnancy. It's never too late to stop drinking. If a woman does drink when she's pregnant, it's healthier for her and her baby if she can cut back on her drinking as much as possible. This is harm reduction. It reduces harm to her and harm to her baby. Healthcare professionals and counselors can help. If a baby has been prenatally exposed to alcohol, talking to a healthcare provider and watching for any physical or developmental challenges can help protect the baby. Putting early supports in place, getting a diagnosis when the time is right, and supporting the family may help prevent some of the adverse impacts that can come from prenatal alcohol use. Support, not shame, helps a family. And I'm just going to include that sometimes we have another addition to our chat that says family advice on alcohol. A lot of families will say it's fine to use alcohol in pregnancy. So, every community is different. In some communities, drinking alcohol is very common. In others, it's not very common. Some communities have banned alcohol and are dry. It depends on so many things. Religion, opportunities to get alcohol, past generations, past experiences. and also provincial, territorial, and local laws. So I guess for the last little bit of discussion, I could just quickly throw out or ask you to join in. What do you see in your community related to alcohol? Do you see a lot of alcohol use? Not much alcohol use? Just, how common, or what do you think is happening? What do you see? And I see I've got some people typing. Thank you. It's normalized. Mental health and addictions in my community. Lots around. Very common. And I see another answer is coming. Very common. Around, yes. The religious is a lot of alcohol use. And it is a concern. And I know there are some communities that have, bootleggers, even though it may be dry or there are certain restrictions. There are people who are selling alcohol in order to make money. I live in a nationally identified poor area. I see lots of alcohol abuse, violence, and property crimes. And so in your communities, where there is a lot of alcohol use, it probably has a great impact on hospital visits and police interaction, family problems. You'll probably see family members, friends fighting more because they're using alcohol. But now that I've brought that out, what is happening with alcohol in your community? I'm wondering if there is some information some of you can share related to what are some of the things that are happening in your community that are maybe making some changes in alcohol being a norm, or maybe making some changes in how often people are choosing to drink or opportunities for accessing. When talking about the negative is one, but it's also good to add the positive. School presentations, thank you. And I see a couple more answers are coming our way. Nope, multiple attendees are typing. No last call announced in bars, shortening the sale. More information available. Yes, shortening sale hours, no more information being available about alcohol. I'm concerned that the Ministry of Social Services is directly paying social assistance to recipients, and that's causing family issues. It's not a positive, but it is a reality. Yes, there is a lot of concern about that issue, about that change to social assistance payments. And it's also hoped that, say, a presentation like this or sharing information or giving some information to share can be a benefit as well. Supervised housing for people to help them get back on their feet to help with addictions. Thank you. Culturally appropriate programming. Yes, thank you. COVID has brought a better community caring aspect. Yes, COVID has definitely made some changes. That is true. And it's good to see the community, people caring for other people. And something that I have noticed actually with relation to COVID, and there were some concerns that I've seen or heard about with people being able to access, those who are in recovery and trying to access services or AA meetings. And most of the meetings have been shut down, but there was a lot of online internet meetings, and I've heard feedback that they can be pretty exciting and pretty good. It does kind of impact to some extent maybe that confidentiality thing, but it has given people a chance to connect from all over the world actually. The detox in Regina is still open and actively being used. That's wonderful. And I see another answer is coming in our way. So I'm slightly surprised that the liquor boards are staying open as essential. I hear you. I actually wondered if that might come up in this presentation, so I was looking up some information, and they were talking to someone who is works at the CCSA, Canadian Centre on Substance Abuse and Addictions, Catherine Parody. And she does recommend that Canadians try to stick to Canada's lowest drinking guidelines, period, like at all times, but especially now that we are dealing with COVID and we're dealing with social isolation and the various differences. She is saying people should keep a close watch over their alcohol intake in these times. It's not a black and white issue, but we need to be extremely careful and be mindful of our drinking patterns. And she recommends that we stick to the low-risk drinking guidelines and that moderation is particularly important with almost everyone under orders to stay home. When you exceed 2 to 3 drinks a day, you have less patience, you're more irritable. We don't have time for that right now. Now, the liquor stores are open in many provinces still, and some have closed them. There has been concern about shutting down the retail stores. Many have felt that it should be cut down, but Catherine Parody from CCSA did say a sudden move to cut off alcohol sales could lead to bad health outcomes and possibly add to the burden of a healthcare system already under strain. For Canadians with severe alcohol abuse disorder, going into withdrawal with little access to medical care could have some serious consequences. And it's very important that people who quit drinking do so under medical supervision, which is more difficult to get right now. And Toronto's medical officer of health has made similar comments, saying if access to booze was cut off, it would lead to pretty significant health consequences. So, could lead to, moderate drinkers could suffer. This is Catherine Parody again. If access to all alcohol is restricted, it could lead to stockpiling, which in turn could lead to excessive drinking. What we know is that for many people, having more alcohol than usual in their home increases the frequency and quantity of alcohol they drink. It's very tempting to use more than usual. There's also research that came out of Japan after the Fukushima nuclear disaster. People in social isolation during that crisis were more at risk for developing alcohol abuse disorder later on, and the trend was particularly strong with seniors. So it did say after this is all over, our healthcare system will require more resources if people cannot go back to their earlier levels of consumption. So alcohol use is definitely a concern at this time. And as part of the conversation, yes, people always want more of what they can't get as well. And one could argue that discontinuing treatment could also result in health issues. Yes, it's a very difficult time to be talking about. Yeah, it's just a very difficult time. Should the alcohol be available for sale? Should it not be available for sale? What impacts will it have on people? It's a difficult question. I have shared this, what help is available for someone who needs help to reduce or to stop drinking. And once again, in these times of COVID, it's more challenging to call Healthline 811 because those lines have been quite impacted by people calling in with the other health concerns. But for someone who does need help to stop drinking, when the timing is better, call Healthline 811. Talk to a healthcare professional or addiction services. And there's the First Nations and Inuit Hope for Wellness helpline, 1-855-242-3310. And one of the other things I had down just to chat about quickly at the end, some suggestions for local possibilities to help people reduce or stop drinking. And this doesn't work as well in a time where people are in social isolation. But try doing things like take a language class, have coffee with a friend. Right now it would have to be a virtual language class, have a virtual coffee with a friend, dance in your living room, read a book. In the areas where we're able to go for walks, go for a walk, making sure that we keep that social distance. So in summary, alcohol is a commonly used drug in Canada. It has risks for anyone who drinks. It is a teratogen. It can cause fetal alcohol spectrum disorder. People can lower their risks by following Canada's low-risk alcohol drinking guidelines.